Okay, so welcome back. So this is the third session of a series of lectures. And we will discuss the mathematical model for biomedical signals. But this will be the second version, which is kind of an improvement of the first version we discussed in the second session. Okay, so the question is again very simple. The question is cosine really the right model for oscillation? Okay, remember what we did before. The model was we have a cosine function, summation is AI A L T cosine 2 pi B L T, right? Plus trend plus random process as noise. That was the model, and we assume there are finite components. Here we put cosine function. The question is cosine really a good one? If you pay attention, yes, these two guys, they are good. Behaves like cosine. But is this signal behaves like cosine function? That is something we can argue, right? But anyways, that is the first question I want you to think. Is it a good one to use cosine? Now I give you another example showing you that cosine is actually not suitable for many biomedical signals and many other signals. Why not? If you pay attention to these two ECG signals, electrocardiogram signals, that are recorded simultaneously from a subject, then what you see is the spikes, the peaks, they align very well, but they do not oscillate sinusoidally. Why? We all learn what cosine function is. If you say, this guy is close to cosine, then I bet your cosine function is defined outside the Earth. It's in some alien culture, right? It's not cosine from our knowledge, right? It's far from cosine. But then you can say, hey, well, I don't agree with you. Although this is not cosine, but say it is periodic. So actually it can be written as a summation of multiple cosine functions via Fourier series, isn't it? Why not? Why don't we do it? Okay, here comes an interesting question. Then what is the right model? Yeah, you're right. You can use Fourier series to rewrite this. Very good. But is this really the right approach? Or what will be the problem? What's the kind of conflict here? And what do we want? Don't forget, our goal is to analyze this signal. And this signal is something field experts, in this case, physicians will care about. Not just what we care about as mathematicians. Okay, we have to talk to physicians. I give you another example, which is, again, an ECG signal. And this ECG signal is very interesting. Well, interesting for us, but very unfortunate for that patient, because this patient encountered this intraoperational myocardial infarction. So you see, in the very beginning, this is P wave, P wave, P wave, QRS, but there's an ST segment, and you can see there is some kind of ST elevation, which is an indication of myocardial infarction. You see peak, and this is very high, but usually it's peak and down to earth. You can see the dynamics. Okay. What do you observe from this signal? You observe two ingredients. The first one is the peak-to-peak interval. Peak-to-peak interval, the length changes from cycle to cycle. It's not fixed. Also, as I told you, there is some ST elevation, so you can see the shape changes. Agreed, isn't it? What does physician do? Usually is, we read the morphology, we read the shape, and we define, hey, what's going on? Because the morphology in time domain itself encodes the necessary physiological information that we want to see. And moreover, the change in period, that is the R interval, it encodes the heart rate variability that we discussed in the very beginning. So both are very important for physicians. So the information of oscillatory pattern or instantaneous frequency should be respected and separated. We can surely write everything in a cosine function and even use Fourier transform to study the signal. You can do it. That is how the power spectrum looks like. You can do it, but it is very difficult to interpret. And I can bet you, if you go to the hospital, you talk to physicians, they may not even know what Fourier transform is. They will not read this guy to say, oh, Mr. What, your heart has some problem. No, that's not what they do. Okay, so to respect this kind of fact, that is something we can do. And there is a literature in ARCHA 2013. We can replace the cosine function by one periodic function. And we call this one periodic function the wave shape function, which we will use the term from now on, WSF, wave shape function. And this is how the signal looks like. You have a cosine function, and you can see the oscillation, speed increases, amplitude increases. And now it is cosine, and we replace the cosine function by something one periodic. And that is how the signal looks like. It becomes much more complicated, but actually the essence is the same. And where is the Fourier coefficient or Fourier series come from? Here it comes from. You have SI. SI is one periodic, as I said. It can be written in a summation of infinite sums of different coefficients, which depends on the regularity of SI. Actually, the summation, the meaning of summation depends on the regularity of SI. If it's very irregular, this is in a distribution sense. If it is greater than 1, remember C1 alpha, alpha greater than 1/2, yeah, then it is uniformly, it is defined uniform. Okay, and when LO is 1, usually we call it the fundamental component. Otherwise, we call it the LO's harmonic. That will be the terminologies we will use. So you will see, in this sense, although we have K components, okay, K oscillatory components, but if we prefer to work with Fourier modes, that is to work with cosine functions, then we are actually dealing with infinitely many modes, not just K. We work with many. Okay. Moreover, if we work with this guy, this alpha, this beta, they do contain information, but that is not the information physicians read. Physicians read SI. So there are several facets of the same model, the same signal, and we want to find the proper one for our final purposes. Okay, I will introduce you several different aspects and design different algorithms to analyze it from different angles of the same model. And this is an illustrative example with one component. In this example, if you pay attention, you will see the signal oscillates slowly in the beginning and in the end, and faster in the middle. But the amplitude modulation is small in the beginning, but large in the end. If you just focus on these three signals, that is the common ingredient. But you don't need mathematics, you just need your eyes. You will see that these three components, they do not oscillate in the same way. Okay, that is, the wave shape functions are different. The wave shape functions are different. Okay, so what do we want to do? We want to get AI, VI, not only, but also SI, so that we can fully understand the signal, the model. And now this is an interesting topic, which is a multiple component modeling of the PPG signal, photoplethysmography signal. On the left-hand side, I gave you 3 different, very basic idea that the PPG signal encodes respiratory signal. The first one is encoding the respiratory signal as a baseline wandering. That is, the signal will have go down, go up, and go down, and go up again. And this follows respiratory signal frequency. The second one is, you see, it is the amplitude that changes. Third one, it is the frequency that changes. So this is called frequency modulated PPG signal, which encodes, all of them encodes respiratory signal. And mathematically, what we can write it is in the following way. We can write PPG signal as the cardiac component AC, SC, VC. This is a cardiac component. C stands for cardiac component. And we have the trend or baseline wandering, and the CT, which is noise. And usually, we have capital T of T is written as AB, SB, VR. And that is called the RIIV, respiratory induced intensity variability. And plus some lower frequency components. And those lower frequency components includes a lot of useful information, like oxygen level, or whatever. We are still doing physiological study about its mechanism, but it encodes a rich ingredient. But this guy is called RIIV, which is the trend, encoded up trend. So you can see that already 2 components, cardiac component and respiratory component. And this VR, R stands for respiration, B stands for baseline wandering. Moreover, how to quantify amplitude modulation? It is encoded in amplitude modulation, where we can rewrite AC of T as capital AA, SA, and the VR. So you see, this VR is the same as this VR, but the global phase information is in SA and SV, and you have different amplitudes. And simultaneously, you can also encode respiratory signal in the frequency component, phi prime of C, which can be written as AP, P stands for phase, SP, and the VR. So this is a more complicated model for the PPG signal, which actually doesn't always exist. And that is the change point detection issue we will discuss in, I don't know when, but maybe 2-3 more sessions, we will discuss change point detection, which means the baseline or respiratory RIIV may not always exist, may exist, may not exist. We want to detect when it exists. Amplitude modulation respiration may exist, may not exist. We need to detect it. Frequency, or this frequency modulated encoded respiration may exist, may not exist. We need to capture it. But cardiac component usually always exists unless you are dying, which may happen. Like during the surgery, sometimes we need to stop your heart, and when the heart is stopped, you are not dead, then you don't get cardiac component. But in real life, we do not discuss it. So this is just from the model perspective. Later on, we need to do some inference, and we'll come back to this model a bit. And actually, more complicated things can be discussed. For example, instantaneous frequency, amplitude, you can even model it by random process. And the question is how to study this random process. What will be the properties we can capture? Okay, and the similar situation holds for electrocardiogram. And you can see this is a baseline wandering, amplitude modulation, frequency modulation. And another example tells you that the morphology actually encodes a lot of information. For example, in the end-tidal CO2, this is the inspiration, this is the this is expiration, okay, where you record the entitled CO2 from the horizon. This is expiration, okay, and this is inspiration. This is expiration downward, and you have inspiration baseline. We inspiration, okay, you don't release any entitled CO2, but when you are expiration, you release CO2. And depending on the morphology, actually we can do that. Physicians can do diagnosis. So this is exactly the same philosophy as what we do for ECG signal. Physicians read the morphology and even manipulate the morphology in some way so that they can get physiologically useful information. Okay, so far you may have the following question. When we talk about modeling, usually we write down differential equation or even partial differential equation. But I don't see any of those here. What's going on? Okay, so this model, actually we call it a phenomenological model. That is, our physiological system is far too complicated than what I can write down. I may be able to write down something very simple, but that simple model is far from sufficient for me to do data signal analysis. So we choose to use functional properties to describe what we may observe in practice. Okay, instead of writing down specific partial differential equation or ordinary differential equation and estimate of the parameters. Okay, so that is the fact. A common fact above is that all models are designed to describe some observed phenomena. It's not really trying to specifically encode the mechanism. Can we consider all the PDE even stochastic differential equation to better model describe the signal? Yes, but it's not focused today. And to be honest, it's very challenging. And I haven't had any successful story so far. There are some successful stories in mathematical biology or even in mathematical physiology. But how to do the combination, that is, we still need some time to explore how to do it. And but this is not focused in this series of sessions. And again, as we have discussed, the model is not unique. There are several different aspects you can describe to model the signal, and only capture part of the reality. Sorry, I don't claim that I can capture everything. Usually we see something, we do the signal analysis, we design an algorithm, and we find results, and then we found some insufficiency, then we have to update the model, and so on and so forth. For example, the adaptive harmonic model was considered back in 2010 when I worked with my PhD advisor in Gridopchis. But then we designed an algorithm and we applied to real data, and I realized that, hey, come on, the cosine function may not be a sufficient one. So in 2013, I introduced this adaptive non-harmonic model and tried to introduce wave shape function, etc. So it only captured part of the reality. Okay, and usually it is invalid outside the imposed conditions. For example, I told you I want the model to satisfy the following conditions. That is, the amplitude modulation and frequency modulation should change slowly. Suppose they change very fast, then what will happen? Sorry, the algorithm can still be applied, which the algorithm I haven't discussed, but the algorithm I will introduce can still be applied, but what will be the result? I cannot tell you, because it's invalid. All the theory and the developed algorithms are invalid outside the imposed conditions. And overall, it can be done in different levels of abstraction. Okay, verbal one is very general, physical one, mathematical one. Okay, so which one? I mean, somehow we are here. Okay, so it's not very, very super precise. Okay, to be very limited, but it's general enough for us to capture sufficient information. Okay, so there are some more discussions. For example, Einstein's principle. scientific theory should be as simple as possible, but not simpler. So that is actually what we try to follow, the philosophy. And you also see some slogans in data science, for example, all models are wrong, but some are useful. Okay, I never claim that the model is correct. It's always possible that we find a better one. Okay, but I found it useful. That is why I discussed it here. Everything should be made as simple as possible, but not simpler. This is the same as above, but some people say it's probably not from Albert Einstein, which is very interesting. I really don't know where the origin is. So whatever, just an FYI. And there are some very nice textbooks in this topic. Okay, so I would highly recommend you to pick up any of them to read. For example, this is the main textbooks in Weblit, which is a very balanced one, in particular from applied harmonic analysis perspective. And this is by Steve Mala. This is by Patrick Fangin. They are all very, very nice literatures, and I grew up with all these literatures. And these two are more mathematical. In case you are interested in harmonic analysis, hardcore harmonic analysis, these two will be your must read. And this one is more from representation theory perspective of time frequency analysis. There are some more, but I show you those because those are the literature I grew up with. Okay, so that is the third session.